A talk on the breast cancer. Sara Maiman, working as a consultant general surgeon at Department of Surgery under the mentorship of Professor Amreen Munir. And today I'm here to have a talk on the breast cancer in Pakistan. So we'll just overview the presentation. We'll understand what is a breast cancer or the cancer itself. What is it? Its global prevalence and the prevalence in Pakistan. What are the differences and why are the differences? The associated risk factors, the global risk factors and the risk factors associated with Pakistani population, the little we know about it and the ways of dealing with it. So let's discuss that what is a cancer? A cancer is a disease that is caused by the abnormal proliferation or the uncontrollable proliferation of the cells and which spreads into the surrounding tissue. This usually, in any case, whether it is a breast cancer or any cancer, occurs due to the mutation in the genes. So it is inherited as well. The prevalence, as far as the global prevalence is concerned, according to the consensus of 2020, there were 2.3 million women diagnosed with breast cancer, out of which 685,000 died. At the end of 2020, there were 7.8 million women alive who were diagnosed with breast cancer in the past years, making it the world's most prevalent cancer. These are the statistics of 2020. It has increased by 2022 more. So the prevalence in Pakistan, it is the highest incidence in Pakistan. It is the most common cancer in Pakistan. When we talk about South Asia, it is Pakistan is at the highest rate. As women are becoming more aware, they are reporting it more. So the prevalence overall will increase more. According to the International Agency of Research on Cancer to 2018 report, 36,000 new cases of breast cancer have been reported in Pakistani women. There was a recent study conducted in this regard in Punjab, and they projected that by the end of 2025, more than 70% of the women will be involved by the breast cancer having age group of less than 40. This is a projected figure and we cannot do anything because we cannot prevent the cancer, rather we can pick it early. So as I was talking about the age group, which is a more common age group, so as far as the global prevalence is concerned, it is more common in older age group, the age group greater than 45 years of age. But as far as Pakistani population is concerned, it is we cannot demarcate. There is no single demarcation that in which age group it would be identified more commonly. In Pakistan, in the past, women aged 60 to 64 years had the highest overall breast cancer incidences, while from 2016 to 2025, large increases in breast cancers have been reported. Total projected breast cancer incidence will increase by approximately 60.7% in maximum. Cancers of breast cancer diagnosed in younger women aged 30-34 years will increase from 70% to 130% in 2020 and 2025 relative to 2015 as mentioned previously. Now we'll talk about the risk factors. Dr. Zahir has already in very detailed talked about the risk factors. So we classify it into the modifiable and the non-modifiable. The modifiable ones are the physical activity, the women or the people having sedentary lifestyle are obese, are more prone to cancers, not only breast but others too. Alcohol consumptions, hormonal intake, that is hormone replacement therapy or the OCPs taken by the patient, the reproductive history, the bad reproductive history, first baby after the age of 30, there is menstrual irregularities, all that are the modifiable risk factors if they are taken by the patient themselves, if they can control it. The obesity as mentioned, and the non-modifiable risk factors will be aging, you cannot control it, genetic mutations, you inherit it, early menarche, you can't do anything regarding that, the positive family history of breast cancer, and having dense breasts. Dense breasts are more susceptible to cancer. Now we come to treatment options. I'll just overview it. Before starting the treatment of the breast cancer or any cancer, we first of all stage it. We stage it according to TNM. We should know the T, that is the size of the tumor. We should have the nodal status, that is N, and we should know the M, metastatic workup of the patient. All that comes after that we have done the proper triple assessment. Triple assessment is what? That we have already discussed in previous presentation, that we should have a thorough clinical history, clinical examination, the radiological investigations, and the histopathological evidence. Radiology before the age of 35, ultrasound after the age of 35, memo. And histopathological evidence nowadays more recommended is the core cut biopsy in state of FNAC, as previously mentioned. So after that we have staged the tumor, then these are the options. These options single-handedly do not deal with the cancers, but they come in adjunct to each other. Surgery, radiotherapy, chemotherapy, hormone therapy, and the targeted therapy of the receptors, and the palliative care when it is stage 4 disease. Now, specific to Pakistani population, there are some fears and barriers which hinder the detection of the breast cancer. These barriers could be the individual barriers because of lack of awareness, and most of the people go for spiritual healing. Piro fakiro ke paas log chale jate hain for the breast cancer, thinking that it would heal it. So it is a barrier, and the lack of support of the family. Most of the times people do not support if their wife, their mother, their daughter is suffering from breast cancer. Then come the structural barriers. That is because these are the financial constraints. And at some areas, the apathetic medical services, not available everywhere. And then come the socio-cultural factors. That is feminine sensitivity. औरतों को लगता है कि अगर उनको कैंसर डायग्नोस होगा तो कीमो लगेगी, बाल चले जाएंगे या ब्रेस्ट निकाला जाएगा, their cosmesis, their beauty is affected. So because of feminine sensitivity, they are less likely to present in front of the doctor. Stigmatization and the aversion to male doctors, this is a very big factor in peripheries. Factors हमें पता चल गए, what are the barriers, क्या हैं, क्या मसाइल क्या हैं, then we have to, how should we deal with it, what should be done in that case. So we should know our role as a doctor, and we should know our role as a doctor community, on community level what we can do. So role of as an individual is that we should spread awareness. We should conduct such seminars, awareness programs, not only this in local clinics, in peripheries, the awareness programs should be conducted. What will happen by that? The people will become more and more aware, and they will pick the cancer at an early stage. Early stage पर pick करने से we can save the mortality by even half of it as per the states. So spreading awareness is the key. Then comes the self breast examination, as we have been repeatedly talking about this in the previous previous presentation, that each and every woman should be educated in a way that they should know how to self-examine their breast at home, how they can get examined from if they do not know, they should learn it, or they should get themselves examined by a doctor, a midwife, or any of the medical personnel. Then the early screening and detection. Early screening, as already discussed, that early screening should be done. The recommended screening limit is given after the age of 40. All the women should undergo mammogram. That is the screening mammogram. But if the family history is positive, it is even recommended after the age of 30. So screening is very important, and early detection is important. Then comes as a doctor, we should know the recent trends, that what are the recent guidelines in the management of breast cancer. So we should keep ourselves updated. This is our role as an individual. What we could do, this is a slide, Sir Iqbal was repeatedly saying that what are the steps of self-breast examination. I've added it, and it is already shared in the pamphlets, that basically these are 6 steps. First, the women should see themselves in the mirror, keeping naked, seeing both the breasts if there are any changes or not. Then is this step 2, in which that after that you have checked, you have to lift your arms up to see that if there is any dimpling or changes in the breast in front of the mirror. After that, the lady has to lay down, whether while sleeping over a pillow or a couch or while taking bath, she should lay down and then examine the contralateral breast with the contralateral hand. Like if she is examining the left breast, she should use her right hand. With a single breast in the clockwise direction, she has to examine it by the whole fingers, not only the tips. and by then pressing those fingers at the end at the nipple areola complex, pressing it to see if there is any change. In case she finds any thickening or any discharge or any irregularity as compared to her previous examination, or which she finds it abnormal, then she can take the help of another hand, and by both the hands she can get it confirmed and then get evaluated. Okay, so we were discussing that what should be the role as an individual. So role as a population, role as a community, we should empathize with the breast cancer patient so that they should not suffer more mentally. We should educate our women. We should build such awareness programs. This occurs from the higher levels. This should be the part of the curriculum. This should be taught to every nurses from their starting years so that they can spread awareness in others and educate themselves and in their families. We should remove the financial constraints. Again, it will come from higher authorities as a community. Whatever little we can do, we can establish such hospitals, and alhamdulillah, we are establishing. There are many cancer centers by now, and this will increase the treatment, the management of the breast cancer. We should conduct research. As a population, it is very important to have a particular research database. As we were discussing that what is the clinical presentation of breast cancer and the benign breast disease, how we will differentiate. So as what we are seeing in our population, the presentation is very atypical. Normally breast abscess, which we used to consider it as a breast abscess, now it is coming as an inflammatory breast disease. So it is very difficult nowadays in Pakistani population to evaluate whether that is benign or malignant only on clinical grounds. We have to go for triple assessment, but presentation in Pakistani population is very different. And creating research databases, we should have a database. We should ourselves evaluate what are the risk factors which are positive in our population. जो हम यहाँ पर पढ़ते हैं, non-lactating mother हो, जिसने यानी late उसके मीनार की हो, या hormonal replacement therapy ली हुई हो, और भी बहुत सारे जो common risk factors हम पढ़ते हैं, those patients who are not having any of these are also suffering from cancer. So means there are some factors which are still unknown and needs to be evaluated, and that will be evaluated on the basis of what we conduct as a research. Again, the key is early detection can save lives. Thank you.